Okay, we are going to get started today. I want to thank everybody for joining us. This is COVID-19 and what we know so far and how to plan for the future. My name is Dr. Valda Crowder. You can just keep it simple. Everybody calls me Dr. V. I'm an emergency medicine physician, and I've been practicing now for 30 years. And I've treated patients across 4 pandemics and also two category 4 hurricanes. Now, for the information that we have on this presentation, the original source documentation is going to be at AskDrV.us. So that's where you go if you want to get any of the original source documents that are used for this presentation. You can also follow me on Twitter at AskDrV. The structure is 10 to 15 minutes of a slide presentation, and then I open it up primarily for Q&A. And the presentation ends when everybody gets done with their questions. Sometimes we have a lot of questions, sometimes we don't have a lot of questions. The goal is for people to really be able to ask about what's really going on in their lives so that they can get some idea of how to handle any particular situation or circumstances. During the presentation, everyone is in listen mode. If you want to ask a question, you can type it into the chat icon, or you can also type it into the Q&A. I take written questions first. Depending upon the number of people, we may be able to open up the lines and allow someone to ask a question live, but that really depends upon the time and the number of people. Okay, so let's get started. The intention is to keep webinar participants informed about COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome is that you'll leave the webinar motivated to create an action plan for you and your family. Or in some cases, you'll create an action plan for a community. You may be responsible for a union, a school, an HOA, or some other group of people or business. It took the US 99 days to reach the first million cases, 43 days to hit the second million. 28 days later, we had the next million and reached 3 million cases. The 4 millionth case came after 2 weeks, and we jumped to 5 million cases in 6 days, and we just recently went from 5 to 6 million cases in 22 days. So essentially, we're doing about 1 million cases every 20 days. Right now, what they're looking at is a lot of the hot spots are actually occurring in the middle of the country. In particular, Iowa. Iowa is having one of the highest case rates and is particularly becoming a hotspot. Dr. Fauci said that these 7 states need to be on alert. These are primarily rural states: South Dakota, North Dakota, Iowa, Arkansas, Missouri, Indiana, and Illinois. So those are the 7 states right now, primarily the middle of the country, that are particularly having a problem. How do I know if I or my family member has COVID-19? The diagnosis is made in 3 ways. You can have a PCR test, an antigen test, or by CAT scan, a chest CT. So let's go over that. A PCR test is actually a swab of the nose, is most accurate 8 days after exposure, and it can be inaccurate if it's done too early or done too late. An antigen test actually detects the proteins on the surface. It's a rapid test, and it can be negative 20 to 30% of the time when the person actually really has COVID-19. So if the antigen or the rapid test is positive, it's usually true. If it's negative, you may need another one. So in the hospital setting, we do 2 tests, 2 rapid tests before we determine if someone is actually negative. The other way to determine, so we have situations where people's COVID-19 test repeatedly comes back negative, even though we think that they have COVID-19. In that situation, we do a CAT scan of their chest, and we see sort of a ground glass appearance or a pacification that's consistent with COVID-19. And so sometimes we actually make the diagnosis that way. As everyone knows who's been on this more than once, it's highly contagious, only requires 45 seconds of exposure, And about 60 to 80% of the people who come into contact with COVID-19 will actually get it. That's different from the flu. With the flu, 30 to 40% of the people who come into contact with it will get it. COVID-19 operates as both a droplet and an airborne disease. We did not know that when the disease first came out. We thought that it was only a droplet disease. A droplet disease would be like Ebola, pertussis, mumps. An airborne disease would be like tuberculosis or measles. What we find with COVID-19 is that the droplet can form into micro droplets, which are still infectious. So that's how come initially there was a recommendation for people to stay 3 feet apart, and now is 6 feet apart or more. It's very important for people who have asthma. You cannot tell the difference between asthma and a COVID-19 attack. And so I tell people it's very important, if you live with other folks, not to use your nebulizer machine in the house. Either use it outdoors or use it in a garage. So they've identified 6 different clusters of COVID-19 symptoms. I've outlined them here. Basically, cluster 1 is flu-like with no fever. Cluster 2, you have a fever. Cluster 3, you have more GI symptoms. Cluster 4, you have fatigue. 5 is confusion. And 6, you have a little bit of everything. So what we have found is that cluster 4, 5, and 6 are the ones that actually seem to be hospitalized, and also are the ones that wind up either going to the ICU or actually dying. Now, what to do if you just found out you have COVID-19? So 1, you have to quarantine immediately. The recommendation is 14 days. I recommend 21 days because there was a study in Italy where after 14 days, people were still positive. What are the things you have to have for your quarantine room? 1 is, we suggest a pulse ox. They are $20 to $30 on Amazon. That measures your oxygenation in your blood. If it gets to less than 95, then you should go into the emergency department. The reason why a pulse ox is so important is, unlike other diseases, with COVID-19, you do not know that you're short of breath. So you're short of breath, but you don't know it. So we call them happy hypoxics, because they're happy and they're hypoxic, which means not enough oxygen. Also zinc, vitamin D3. These are good for people to use even who are not COVID-19 positive during this pandemic. You want to have access to a bathroom that's only yours, a cell phone. You want people to leave food by your door and open up your windows, or have a HEPA filter. All right, just quickly a little bit about masks. The KN95 mask was invented by Peter Tsai, a Taiwan person who did his PhD in, I believe, Rochester, New York. And basically, it's an electrostatically charged fabric on the outside of the mask that attracts the particles. That's why it's very important not to touch the outside of your mask. His recommendation is 7 masks, 1 for each day of the week. Hang them up when you're done. The time of a week will allow each of them to have the viruses, if they have virus on them, to deactivate. Then you can reuse them. Some of the masks that you'll see have a valve. It's very important to use the mask without a valve. A valve actually allows you to breathe out, and you don't want to be breathing out in a pandemic because you don't know if you're an asymptomatic carrier of COVID-19. This is just an article that shows that the CDC actually asked people to avoid masks with an exhalation valve. This is a mask coming on the market. It's $15. It's clear, FDA registered, not approved yet. It's an N99, so it blocks out 99% of the particles. It has active ventilation, and it has a HEPA filter. Now, you'll see neck gaiters where people have some fabric and they pull it up over their nose. This has actually been associated with increased transmission of COVID-19. So it's recommended not to use this. So the main point on masks are that you want to actually filter as much of the air as possible. Layered fabric, 3 layers is preferred, 5 is 3 layers is a minimum, 5 is preferred. I recommend during this pandemic that people actually eliminate any facial hair. One that allows the mask to actually fit better. And also facial hair is a place where the virus can kind of build up, and then someone can get exposed to a very large amount of it. Now, I get a lot of questions about face shields. Do they work as well as a mask? They do not. So I would only use a face shield in addition to a mask, but not by itself. Now, what difference does a mask make? Now, the person on the left has COVID-19 and the person on the right is healthy. If the healthy person has on the mask, the transmission probability is 70%. If the COVID-19 person has on the mask, the transmission probability is 5%. If both of them have on the mask, then the transmission probability is 1.5%. So let's talk a little bit about the long-term effects of COVID-19, because there's been a lot of conversation about people dying, but there's a lot of long-term effects. 75% of the COVID patients coming out of the ICU have post-intensive care syndrome. We are going to, for a long time, be dealing with COVID-disabled patients in our country. These 75% either have cognitive, mental, or physical impairment. So they have renal failure requiring dialysis, limb amputations, strokes, decreased lung capacities where they can't actually walk or clean or walk a normal block or two or clean house. Now, this was also recently, this was today in the paper and very important. So they looked at Big Ten athletes and that were COVID positive, and a third had myocarditis. And so myocarditis is an inflammation of the heart. And once the heart gets inflamed, it doesn't pump as well. And this is actually leading to a lot of people that are young dying of COVID-19. So what is important about the COVID-19 infection is it isn't the infection itself that causes most of the problem, it's the inflammatory reaction that causes most of the problem. Now, there's been a lot of talk about herd immunity, and people have asked me, what is herd immunity? So herd immunity is where enough of the population gets immune to a particular disease such that it's less likely for people to actually get infected. So there's 2 pathways for herd immunity. One, natural infection. So many people actually get it that, you know, the likelihood of getting it is low. So that's usually around 70 to 90% of the population being infected. The other way to get herd immunity is by vaccine. So this person, Dr. Atlas, you're going to see him more than you see Birx and Fauci now. He actually is a neuroradiologist who has not had that much experience taking care of patients and primarily reads CAT scans and MRIs. And he has been pushing for a herd immunity strategy. So I want to actually just take a look at what that looks like. So let's assume that 80% of the population needs to be affected for us to get herd immunity. Right now, the United States is 330 million people. 80% affected would be 264 million people infected with COVID-19. Right now, we have 6 million people infected, have gotten infected with COVID-19, and that has caused 183,000 deaths. So if you use that same ratio, and you say, okay, we're going to have 264 million COVID cases, that would mean that we would have about 8 million deaths from COVID-19, and that is the time in which we might reach herd immunity. And so as you can see, this number of infections and this number of deaths would really overwhelm our healthcare system. Sweden actually is one of the countries that actually tried to use the herd immunity approach. They actually stopped after it failed, and their death rate is the highest in all of Europe. Now, the other thing that makes herd immunity not likely to occur is that people actually can get COVID-19 again. When you get this disease, you do not get lifetime immunity. In fact, your immunity actually and your antibodies begin to actually decrease in concentration 3 to 6 months after the infection. So we already, as of August 29, had our first patient in the United States who was reinfected with COVID-19. So we had COVID-19 and then he caught it twice. So this is why it's important, even if you've caught COVID-19, that you continue to wear a mask and wash your hands and do all the things that are needed, that are necessary. Now, there's been a lot of talk about vaccines, so I want to spend some time talking about that. This is the vaccine process from beginning to end. The exploratory phase is when you really see how does it work? How does the infection work? Preclinicals where you test it in animals. Those 2 steps were done a couple of years ago with SARS. Then you have the clinical development of the vaccine, which is phase 1, phase 2, and phase 3. Phase 1 is where you do it with a small group of people. Phase 3, you increase the number to a couple of hundred, and then phase 3 is where you really test the efficacy and the safety with thousands of people. So phase 3 right now in the United States is being done with 30,000 patients. There's regulatory review and approval, manufacturing, quality control, and then distribution. So if you look at where are we right now, we have 9 vaccines that are in phase 3 and about another 40 that are in either phase 1 or phase 2. There are 2 vaccines that have been given limited approval in China and Russia, but have not completed their phase 3, complete phase 3 evaluation, which I believe is dangerous. So Moderna, as of October 22nd, they had enrolled 40% of the 30,000 patients that they needed. Now, what's important about the Moderna vaccine, which is probably the one that we're going to see come out the earliest, is that is a 2-part vaccine. So you have to take the vaccine, wait 30 days, and then take the second part. And we yet don't know how effective it actually is. Now, there's been some talk about the FDA opening up authorization for the COVID-19 vaccine before the end of the phase 3 trial. I think that this is quite dangerous. I would prefer to see the FDA wait until the phase 3 trials are actually completed. This is just CDC telling states that prepare for COVID-19 vaccine in early November. Specifically, they cited November 1. Obviously, we all know with the election being November 3rd, why would they want to push we all know why they want to push out a vaccine early. Again, I think it would really make more sense that we go through the entire protocol that we normally go through with our vaccines and complete a phase 3 trial and show the data to the American public. Now, another thing that I talk about is knowing what zone you're in. There's different levels of infection in different places. There's green, yellow. Now, some people also talk about an orange zone. Orange and red, as far as I'm concerned, are the same. So a red zone has greater than 100 cases per 100,000. And it also has a diagnostic test positivity rate of 10%. That basically means you did 100 tests, more than 10 of them come back positive. Yellow has 10 to 100 per 100,000 with a test positivity rate of 5 to 10%. And green has less than 10 with a test positivity rate of less than 5. The American Academy of Pediatrics, I did a paper on school reopenings and talks about all of the things that one needs to actually factor in: group size, nutrition, students with disability, athletics, mental health, and all the things that need to be factored in around schools reopening. So, consideration for your kids going back to school, it's important to look at what is the infection rate in my community. I will tell you, if you're in a red zone, I wouldn't recommend that your kids go back to school. There's too much community infection in that particular area. If you're in a yellow or green zone, there may be a way in which you can do it safely. So covidagnow.org is a website where you can actually look up your specific county, right? The other thing to factor in is, what is the age of my children? Are there other people living in my home that are at high risk for not doing well with COVID? Does grandmother live at home? Does a great uncle live at home? These are all things to consider. This just actually shows the COVID Act Now website. What's important is you click the state, and when you click the state, you will then see the counties within there. So if the state is red, it doesn't mean all the counties are red. So you really have to click the state and go down to a county level. So what have other countries done to reopen schools? They've decreased the community infection rate. That's number one. They decreased class size. They moved the desk more than 6 feet apart. They remove public water fountains. They provide PPE for teachers and administrators, more frequent cleaning of rooms and offices, and universal temperature testing. This is a COVID risk chart, which is on our website. And this kind of risk, what are the things that are really dangerous to do versus what are the things that are safer to do? So obviously attending a large church service, going to a bar, these are things that are more dangerous to do. Less dangerous is going to a beach or shopping mall. As we go down, then we go into things like eating at a restaurant outside, playing golf, going for a run or a ride with others, and then playing tennis or going camping, or opening the mail, which is number one. So that's basically what we have for today. All right, I'm going to switch over to Q&A. So let's see, let's go straight to our questions. Oh, what about a rapid test? Where are we at? So specifically, are talking about the saliva direct test. So that is a test that you can test at home for COVID-19, almost like you can test your blood sugar at home. That did receive FDA approval. I haven't seen it on the market yet, but it did get FDA approval probably about a week to 10 days ago. All righty. Yes, I know. People are telling me they don't want vaccines from China and Russia. I get it. I get it. All righty. If you have any other questions, go ahead and type them in the chat. Since we have a smaller group today, you could also raise your hand and I'm going to be able to unmute someone. You can type in the chat or type into the Q&A. I'll give people a minute here. One of the other things that I think is really important is things are going to get a lot worse come the winter time, and it's very, very important to get your flu shot. I know I just got my flu shot today. Once you get your flu shot, it takes about 10 days to actually work. It's very, very important to get your flu shot. Okay, Mitch, you can unmute yourself and ask your question.
Okay, can you hear me?
Yes, we can hear you.
All right, thank you. Now, two questions that came up. You encouraging everyone to get their flu shot. When I get a flu shot, I usually get a bonus with it. It's called the flu, and I'm usually sick for 2 or 3 days. So that's number one. I mean, are these flu shots, are they getting any better where I don't get the bonus plan, or are they, am I just the lucky ones that get the flu as a result?
Yeah. So no, that does happen. That does happen to people sometimes. I think that over time, the flu vaccine has gotten better. I don't know when was the last time you took the flu vaccine, but
About less than a year ago, Valda.
Oh, less than a year ago. Okay.
Oh,
all right.
yeah.
So then, yeah. So no, there hasn't been a dramatic change in the quality of the flu shot in the past year. I was going to say, if you had that, I know I had that experience about 8 years ago, and I know I don't get that experience anymore. But if you had that a year ago, nope, there hasn't been that much of a change in the flu shot in the last year or two.
Okay. Now, the other question I had, as far as rapid testing goes, is anybody making movement on it that you could tell? I know that there was a product that was approved by the FDA. You talk about a couple of different products in the past. Have you heard of any movement? Because I just can't believe that with this, I mean, once this comes out, it's going to be a game changer and could be more impactful than a vaccine.
Right.
But
It really could be.
yeah, absolutely, if done right. But God only knows
Right.
if that's going to happen. Having said that, I can't imagine why people would, with this technology, would not be pushing it as hard as they possibly can. So
Well,
have you
yeah.
heard anything new?
So I haven't heard anything new, but let me just say this. I think that some people are thinking about a vaccine like we normally think about a vaccine. So let me give you an example. If I get the polio vaccine, I don't get polio. Like the likelihood of me getting polio is like less than 1%. This COVID-19 vaccine is not going to be like that. Dr. Fauci was on a scientific presentation and said that he hoped that it was 70% effective. So think about that. You got to take 2 vaccines, but you still have a 30% chance of getting the disease if you wind up getting in contact with it. That suggests that the vaccine may not, or at least this first round of vaccines, may not be the answer. And I think the rapid testing, where people can test at home and quickly determine whether or not they have it in quarantine, is actually going to be the answer.
Oh,
So
definitely.
I agree with you. The rapid test is, I think, going to be the game changer. But people seem to be really focused on the vaccine, and I think it's probably, hey, I hope that if we get a vaccine and it's 95% effective, that'd be great. But I haven't seen that vaccine yet, even being studied. So there is one that is in the earlier stages. I think it's phase 1 or phase 2 by Johnson and Johnson, that is showing much better progress. But in general, I agree. The rapid test and the home test is going to be the way to go. I haven't seen it hit the market. I haven't seen, but I'm sure if they got FDA approved, trust me, they're going to get on the market. They will get on the market, and the price point is low. It's like $1 to $5 per test. So if
So
I had, to,
I know
if somebody had to test themselves a couple of times a week, it wouldn't be a big deal.
yeah, I know the last time we talked about this, you gave me the name of the company, and it was a domain that was still available, a web domain available
Yep.
for sale. It didn't, but
Right.
anyway, be that as it is. I have another question. I just can't remember it right now. I'll let you go to somebody else.
Okay. All right. Okay. All right. Thank you. I've got something here in the chat, in the Q&A. Let's see what's in the Q&A. Okay, should we space our flu, shingles, and pneumonia shots? I am 71. Okay, so I would space the flu and pneumonia shot. If you haven't gotten a shingles shot at 71 right now during the pandemic, I wouldn't get it. So the shingles shot has been shown to decrease your immunity. So you do get a little immunodeficient with the shingles shot. So I would get the flu shot first, because that takes about 2 weeks to work. They're free at CVS. I just went and got one today. I stood in line. They're totally free, so I didn't pay anything. And I think they're free to everybody. It doesn't matter if you have insurance or not. They say free flu shot. And then I would get the pneumonia vaccine, probably about 2 to 3 weeks after I got the flu shot. That's what I would do. And I would let the shingles shot, I wouldn't do that right now. So thank you for that question. All righty, hold on just a second. Let me look through this chat and through the Q&A. All right, Mitch, did you remember what it was? Your
Yeah,
question?
I
Okay.
did. This is something I'm seeing quite a bit of, and almost a certainty that people are perverting it. I'd like to address it head on. Now, according to some, the CDC is saying that the number of deaths resulting from actual COVID exposure, sickness, is a very, very low number. They're saying it's much, much, much less than 185,000. They're saying that the vast majority are a result of if somebody has diabetes, for example, the medical complications thereof. Do you agree with that? And
yes. So let me tell you what they're doing. They're talking about, when I've seen that too, and when they talk about that, they're talking about what is our primary diagnosis. Okay. So when someone dies, your primary diagnosis is the thing that actually kills you. It's not the thing that actually started the cascade of events, right? So you
okay,
could catch COVID, right? You could wind up having respiratory problems, and then you could go into renal failure and you could die because of renal failure, right? And then I put on your diagnosis, death related to acute renal failure, COVID infection. I list all of the things, right? So what they're talking about is the fact that COVID wasn't listed as number one. Well, you wouldn't necessarily list COVID number one. It really depends upon the patient's clinical course, right? But these are people who are in the hospital because of COVID, right? And so so they're talking about whether or not it was a primary diagnosis, which, you know, whether or not I make something a primary diagnosis or you make it a secondary diagnosis is like, you know, do I like red or blue? The fact that it is a diagnosis in the patient chart means that it was part of the problem that led to the person's death.
so it caused it contributed to the person's demise.
Absolutely.
Okay.
Absolutely.
If they didn't
And
get
what we're
COVID,
going,
they wouldn't have died.
that's right. If they didn't get COVID, they wouldn't have died. And so as opposed to, and also too, you have to realize is that when I actually, if I make certain things a primary diagnosis, then the billing is higher. So there are some physicians that make, you know, hey, we spent a lot of time on this patient, so I'm going to make this the primary diagnosis because this person used up a lot of resources, right? So you're going to actually find just the opposite, which is the COVID deaths are going to be higher than 180,000. Because what's happening is you have some people who are literally falling out at home, don't get to the emergency department, die at home, and we don't know that it's COVID, right? And so I tell people, think about when D.L. Hewley, the comedian, fell out on stage. He was on a stage. Imagine if that had happened at home, right? And if he had certain complications like cancer or heart disease, no one would ever do an autopsy. They may or may not even find out that he had COVID, and he would have died at home. So, so yeah, we're gonna find that it's actually all the other countries have adjusted their numbers upward, not downward. So I don't believe there'll be any downward adjustment. I would bet money on that. So, okay, all righty. What other questions? Any other questions you want to put in the Q&A or the chat? Let's see here. Let me just check the Q&A. All righty. Anything in the chat? All righty. Anybody have anything? Going once? Going twice? All righty. Going 3 times. I'll give you a little bit of, it's 8:37. And we will finish early if anyone doesn't have anything else. All right. Looks like we do not. All right. I want to thank you guys for joining us tonight. And I want everybody to stay safe. Feel free to invite 2 guests to this next week. The slides, some of the slides stay the same. Some of them are updated. I'm particularly trying to focus in on the herd immunity and the vaccine information because that seems to be coming out at the most rapid pace at this point right now. So I want to thank everybody for joining us. Bye-bye. See you on Tuesday.